Hi everyone, my name is Cik Wan Nur Ainul Zadani binti Cik Wan Razali and my matrix number P4240036. Today I will be explaining how drugs actually work in our body. Have you ever wondered how medicine actually work in our bodies? Just like people, drugs have different personality, and today we will meet the 5 main types: the exciters, the downers, the nakers, the replacers, and the assassins. Stimulation, the exciters. First up, we have stimulants. These are like your morning coffee. They wake things up. Stimulant drugs enhance the activity of specific cells or organs. Stimulation is a type of drug actions that increase the activity of cells, organs, or systems. It's like giving your body a pep talk or a triple espresso. For example, caffeine or amphetamines stimulate the brain, increasing alertness. In medicine, adrenaline stimulates the heart during cardiac arrest. Side effects of overstimulation can include high blood pressure, insomnia, anxiety, seizure, in extreme case. That's why stimulant drugs are used carefully and usually in specific doses. Stimulant says, "Come on, let's get moving." Depression, the downers. Nets are the depressant. No, they don't make you sad, they slow things down. These drugs reduce the activity of cells or organs. Depression is a mental health disorder marked by persistent sadness, loss of interest, and low energy, affecting thought, emotions, and daily functioning. For example, sedative or anesthetic reduce brain activity or nerve impulse. In practice, morphine depresses the respiratory center to reduce pain perception. There is also a risk of too much depression. Now, imagine pulling the brake too hard while driving. You can crash. The same goes for these drugs. Too much depressant action can cause drowsiness or unconsciousness, difficulty breathing, coma, or death, especially with overdose. That's why dosage are so careful controlled and monitor. Depression whisper, relax, take it easy. Irritation, the naggers. Now meet the irritants. Think of them as naggers. They poke or prod tissue to provoke a response. While this may sound bad, it can be useful. Irritation is a drug action that causes mild inflammation or stimulation at a local site to produce a therapeutic response. For example, capsaicin creams irritate the skin to relieve deeper nerve pain. Another case, laxative irritate the bowel lining to stimulate movement. Now, here's the warning label. Irritation can be helpful in small doses but harmful in excess. Too much irritation can lead to ulcers, tissue damage, chronic inflammation. So, healthcare professionals must balance the stimulating effect with patient safety. Takeaway, the goal is control irritation, not chaos. Irritation shout, "Hey, wake up and do something." Replacement, the replacers. Let's talk about the replacers, the helpful substitute. When your body lacks something essential, these drugs fill the gap. Replacement is when drugs supply substances that are naturally found in the body but are missing, deficient, or not working properly. For example, insulin for diabetes or thyroid hormones for hypothyroidism. They don't fix the root problem, but they restore balance. Replacement therapy is all about precision. Too little isn't helpful and too much can cause harm. That's why doses are carefully measured. Regular monitoring is important. Patients often need lifelong therapy. For example, too much insulin can cause low blood sugar, a dangerous condition called hypoglycemia. Moral, replacing something isn't just about adding, it's about restoring balance. Replace it gently, say, "Don't worry, I've got you covered." Cytotoxic action, the assassins. Finally, meet the most dramatic type, cytotoxic drugs, the assassins. They are designed to kill harmful cells, usually in cancer treatment. Cytotoxic drugs are medications that kill or damage cells, commonly used in chemotherapy to destroy cancer cells by interfering with their growth and division. For example, chemotherapy drugs target rapidly dividing tumor cells, but they can harm healthy cells too, which is why side effects occur. Cytotoxic drugs are powerful, and power always comes with risk. Common side effects include hair loss, fatigue, nausea, low immunity due to white blood cell drop. That's because the drug can't always tell the difference between a bad fast-growing cell and a good fast-growing one. But remember, doctors carefully plan doses and timing to minimize harm and maximize the kill effect on cancer. Cytotoxic declare, target lock, eliminating trait. So, in summary, stimulant excite, depressant calm, irritant provoke, replacer restore, cytotoxic destroy. Understanding how drugs act help us use them wisely and safely. The next time you take a pill, remember, it's not just chemistry, it's personality in action. Thank you for watching and take care.